Hello everyone, welcome back to my YouTube channel, The Exploring Medicò. So I am back with the Pharmacology series, that is another section of general pharmacological principles, in which we are going to discuss about dosage form of drugs. In last section, we have discussed about the types of drugs and orphan drugs and the nomenclature of drugs and everything. So today we are going to discuss about dosage form of drugs. In case you have any doubt, you can ask in the comment section. Follow the entire series so that any kind of question or any kind of error can be solved easily. Put the habit of watching the series from first to the end. Okay, so let's start without wasting time. Dosage form of drugs. Dosage form is a product suitable for administration of a drug to a patient. So what is dose or dosage? It is a product or it is a quantity which should be given in a form of a drug to a patient. Every active ingredient has to be formulated by adding other substances. So every drug has other substances like excipients, diluents, preservatives, vehicles. Excipients means any type of inactive substance that serves as a vehicle for a drug, that serves as a mode for a drug, and it is in the form of an inactive substance. Then preservatives is type of the condition in which form the drugs can be stored, and vehicles is a mode of transport, and diluents means something in the liquid form that can dilute according to a specific recipe and packed into a specific dosage form such as tablet, elixir, ointment, injection vial. Injection vial is a cap like this in which the injections medicines are packed, which is of a glass form. Small one is vials, and that we will see in this lecture further, which is then administered to the subject. So various forms are given in which the drug is packed. The dosage form provides body to the drug, demarcates single dose, protects the active ingredients, and makes it suitable for administration in the various ways. The important dosage forms are described below. Now let's see, first is solid dosage forms. So first one form in the solid is powders. The drug is in a dry, finely pulverized state. Pulverized state means in a fine particles in a form of a powder. If the drug is for oral administration, each dose has to be webbed separately or a package packed in a sackets. Sackets means in a bag. If the powder form is in the oral administration, it should be packed in a packets. Therefore, this dosage form is inconvenient and unpopular except when the quantity is several grams, because small quantity cannot be packed in a sackets. You need a more quantity. So, for example, oral rehydration salts, that is ORX. Powders for topical application, that is dusting powder. What is topical application? Means any kind of medication that can be applied to the surface of the body or to the skin area of the body or inside the mouth. That is known as topical application. Supplied as a bulk powders in a metallic or a plastic containers with holes for sprinkling so that you can easily take it. And effervescent powders contains granulated soda, that is soda, bicarbonate, citric acid or tartaric acid, and they react when dissolved in water and liberate to CO2 causing bubbling, that is effervescent powders which contain soda, bicarbonate or citric or tartaric acid. So this was about the powder form. Now next we can discuss the tablet form. The drug is a powdered or a granulated mixed with binding agent and other excipients, compressed, molded into discoid, oblong or other shape suitable for swallowing. As drugs have different shape, but they are all meant for a shape specific in which you can swallow. The tablet may be plain or sugar coated or a film coated. These are the quotations in which they are quoted. Other specialized types of tablet. Now we are going to discuss type of tablet. First is chewable tablets. Chewable are which that can be chewed or swallowed. Ingredients must be pleasant tasting. That is sugar in taste, because if it is not sugar in taste, then you won't take chewing tablets. Like dispersible tablets are what? The tablet is dropped in a small quantity of water wherein it disperses quickly and the solution is then gulped. Which we gulp the tablet are dispersible tablets. Then sublingual tablets that are put under the tongue or the drug is rapidly absorbed from the mouth. The drug which is directly absorbed from the mouth are known as sublingual tablet. Then enteric coated tablets. The tablet is coated with a material that does not dissolve in acidic medium of the stomach. Means enteric coated tablets means this tablet pass through the stomach but that does not dissolve in the acidic medium of stomach. But the tablet disintegrates, means divide into part only on reaching the duodenum. Means when the tablet reaches to the duodenum, then only it starts with dissolving and the action starts. And last is sustained or extended release tablet. Extended release tablet is called EX or RX. These contain drug particles which are coated to dissolve at different rates. Different rate means that are drugs that are released slowly. And the active ingredient is made available for absorption over a longer period of time. Means whenever they need at that time. The duration of action of short-acting 2 to 6 hour drugs can be extended to 12 hours or more. Means drugs is released in a small quantity according to the power of the drug. According to the action of the drug, small power or short-action drugs are 2 to 6 hours which last, and long are 12 or more hours. So the chewable tablets are, as we have seen, that they are having a flavoring test because it cannot be bitter, because dispersible tablets are bitter in taste. Last is controlled released tablets that are a semi-permeable membrane that controls the release of a drug, prolonging its duration of action, in which the drug can be prolonged. Now, next is pills. These are archaic dosage forms in which the drug powder is mixed with honey syrup with a stick mark. Archaic dosage means old formulation. Then this is then rolled into a spherical or oval bodies meant to be swallowed. This term is often loosely applied to tablets as well. In this form, tablet is also applied and they are mixed with honey or syrup. Another form of solid dosage form is capsules. These are water soluble cylindrical containers made of gelatin which are filled with powdered or liquid medicament. They have powdered or liquid medicament. Like Vicks capsules are coming which are in liquid form, then any kind of tablets related to acidity like rabendrazole and etc. are in the powdered form or even in the small forms of the tablets. The container dissolves on swallowing so that the drug is released in the stomach. As you dissolve, the container will, or as you swallow, the container will dissolve. Soft gelatin capsules dissolve very rapidly and generally contain liquid medicament. Enteric coated capsules are designed to dissolve only on reaching the aluminum. As we have seen that the enteric coated medicines dissolve in duodenum, like that enteric coated capsule dissolve in ileum. That does not dissolve in the acidic medium of stomach. And spensules are extended release capsules which are packed with granules of the drug having different coatings to dissolve over a range of period of time in the specific period. Now next is lozenges. These are tablet-like bodies of various shapes containing the drug along with a suitable gum, sweetening and flavoring agent, and they are to be retained in the mouth or allowed to dissolve slowly. So you can have the lozenges in your mouth or you can have this, you can swallow too. Providing the drug for a local action in the mouth or throat. Like you can say example like Leoford of lozenge, Tuscu, Strepsils, these all are lozenges. Next is suppositories. These are conical bullet shaped dosage forms for insertion into anal canal, in which the drug is mixed with a moldable film base that melts at a body temperature and release the contained drug that are inserted into anal canal. Oval or suitable shaped bodies are vaginal insertion called pessaries, which are inserted in the vaginas, while elongated pencil-like cones meant for insertion into male or female urethra called boogies. They are called as boogies, which are pencil shaped. Now next is liquid dosage forms of drug. Already we have discussed solid. Now liquid is aqueous solutions. They contain the drug dissolved in water, may be meant for oral, topical or parental administration. Which can be, you can take orally, as I told, topical, and parental, that which can be occurring elsewhere in the body except mouth and GIT. Oral drug solutions often contain sweetening and flavoring agents. Preservative have to be added because shelf life of water solution is short. Shelf life means the length or a duration of time in which the drug remains usable or which can be consumed. Shelf life means shelf life. Now another is suspensions are the dispersion of insoluble drugs in water with the help of suspending agent. Dispersion means which spread over a wide area in a short period. Emulsions are a uniform mixtures of two immiscible liquids, mostly oil and water, in which the droplets of one, that is dispersed phase. Dispersed phase means of you can say phase that exists in a small droplet form, that is dispersed phase, and are suspended in the other continuous phase with the help of amphiolic emulsifying agent. And continuous phase means what? Continuous means you can say surrounding liquid phase in which the dispersed phase act. So this means to say that mostly emulsions have two mixtures. One is dispersed phase in a form of droplet and one is more in the liquid form which is surrounding. Amphiphilic means that is both hydrophobic, that is water resistance, and hydrophilic property, that are amphiolic emulsifying agent. Milk is naturally occurring emulsion. Both suspensions and emulsions tend to settle down on keeping, should be taken slowly before use. You should shake before taking. The next is elixirs are hydroalcoholic solution of drugs, usually sweetened with syrup and flavored by fluid extracts. Syrup have higher concentration of sugar and are thicker in consistency. We have seen. Drugs that deteriorate in an aqueous medium can be dispensed as dry syrups. Deteriorate means that becomes progressive version, that can be used as a dry syrups, which is reconstituted by adding water and shaking, which becomes more and more worse as the period goes. So it is in the form of dry syrups, and that should be used immediately in a short period of time. The reconstituted syrup must be used within a few days. Linctus is a viscous syrup liquid meant to be licked slowly for soothing the throat. For the sore throat, Linctus is a type of syrup which is used. It generally has a menthanol to impact cooling sensation. And then antitussive. Antitussive is the drugs that suppress cough. So you can say that it is cough suppressant. Antitussive. Then drops. These are relatively more concentrated solution of medicaments meant for oral ingestion or external application to eye, nose or ear canal. Oral drops are the preferred dosage forms of infants and young children. Oral drops are given in young children. Or you can even say that in infants also is given. Eye and nasal drops should be isotonic. Eye drops need sterilization. Drops are supplied in vials with a nozzle or along with a dropper for accurate dosing. Vials is made up of glass for administration. Now you will see one difference for the lotions. These are solutions, suspension, emulsions. Three of this category comes in the lotions meant for external application to the skin without rubbing. They generally have soothing, cooling, protective or emollient property. Emollient property means soothing property and are better suited than cream or ointment for a hairy skin. Liniments are similar preparation which generally contain counter irritants, means in which the part, if one part is given irritation to avoid the pain, and are to be rubbed on the skin to relieve pain and cause rubefaction. Rubefaction is the redness of skin, which causes the redness of skin. Lotions. Next is injections. These are sterile solution or suspensions in aqueous or oil medium that can be given subcutaneous or intramuscular administration. Only aqueous solution, not suspension, are suitable for intravenous. Intravenous injection is IV injection short form, because particles in suspension are oils injected, IV. That particles oil injected Intravenous can cause embolism. Embolism is the blockage of artery, remember. Sometimes if injection is not given in a proper way, then it can cause a blockage where you are told to apply the ice. Injection are supplied in a sealed glass in the ampoules or a tight rubber vials. Now let's see the difference. Vials and ampoules, both are form of glass or rubber. But what is the main difference? Vials is like a cylindrical shape, as I showed further, in which the drug is stored, and size is bigger compared to ampoules. And ampoules are like this shaped, in which only one dose can be stored, and which are smaller in size. Sometimes two injections are mixed via vials and ampoules, if you have seen. Like this shape ampoules are there. They are broken from here and given, and these vials are bigger in shape. Ampoules are broken just before injection and usually contain a single dose. Drug from the vial is sucked in a syringe by piercing the rubber cap, because it is rubber cap. So injection is put inside it and it is pierced, and the ampoules is generally broken because it is form of entire glass. So vials may be single or multi-dose. As I told, drugs which are unstable in solution are supplied as a dry powder vials. Sterile solvent is injected in the vial just before it is to be administered, because vials are not opened. When you are ready to give injection, at that time only you take, and the dissolved suspended drug is then sucked out into the syringe. Some drugs like insulin are also supplied in pre-filled syringes and pen injectors. Large volume intravenous infusions are marketed as grass or polypropylene bottles. Now next is semi-solid dosage of forms. First is ointments. These are greasy semi-solid preparations meant for external application to the skin, eye, nasal mucosa, ear or anal canal. The drug is incorporated in an oily base such as soft or hard paraffin, wool beds, beeswax. These all are the different forms. And ointments are not suitable for oozing surface because they are more occlusive or do not allow evaporation of water, rather than good for dry, chronic lesions. Cream are similar to ointment, but the base is in a water oil emulsion. So ointments are generally same, but they are not like creams. Similar to creams, they are not like in the oil emulsion. The medicament is better absorbed in the skin from creams than from ointments, and the creams are cosmetically more acceptable than ointments. Now paste. These are non-greasy preparation of thick concentration containing hydrophilic adhesive powders such as tarred, prepared chalk, aluminum, magnesium hydroxide, zinc oxide, carboxymethyl cellulose, which swell by absorbing water. Paste may be contain viscous non-oily liquid like glycerol or propylene glycol. Paste can be applied to inflamed or excoriated skin, that is dead skin, oozing surface and mucus. Toothpaste are item of personal hygiene form of paste, and medicated toothpastes are extensively used in dentistry. Medicated toothpaste like which are used specially for a dentistry purpose, that are used for a sensitivity and all. Then gels. The medicament is incorporated in a viscous colloidal solution of gelatin or similar material and usually dispensed in a collapsible tubes. They are meant for external application to the skin, mucosa, provide longer duration contact but are non-greasy and washable with water. So gels are washable with water, and they generally apply to externally to the skin, mucosa and everywhere. Gels are suitable for application to hairy skin, are commonly applied to oral ulcers because they are better retained in the solution. Oral ulcers, you can see the gels are given like Smile gels and every different brands are there. Next is inhalations. Drugs which are gases, volatile liquids can be administered by inhalation, carried into air or oxygen with the help of pouch, mouthpiece, face mask, hood or endotracheal tube. Non-volatile liquids and fine particle solids can be aerosolized using a method dosage inhalers, jet nebulizers, rotaler or spinaler for inhalation through the mouth. So these are the different form of inhalations. In inhalations, various type of respiratory dosage of pumps are given to the asthma patients. This is the example of inhalation. Then pressurized meter dose inhalations, PMDIS. handheld devices which use as a propellant, mostly like hydrofluoroalkane, which can propellate easily, which can be dissolved easily, that are hydrofluoroalkane, delivered a specific dose of drug in the aerosol form per actuation. Per actuation means per dosage. Jet nebulizers produce a mist of the drug solution generated by pressurized air or oxygen. Pressurized air or oxygen are given in the form of jet nebulizers. Rotainhaler is a portable device in which capsule rotacap containing very fine powder of the drug is punctured during an actuation, that is during a treatment. And released particles are aerosolized by the inspiratory airflow of the patient. It means the drug is punctured into the during the treatment, and the particles that are released during the treatment are then aerosolized by the respiratory tract. A propellant can be used as some spin inhalers. Efficacy of the aerosolized drug depends on the particle size. Efficacy means the result you wanted depends on the size of the particle. For example, 1 to 5 micrometer diameter particle deposit on the bronchioles and effectively deliver the drug. So if it is smaller in size, inhalation, then it is effective. Larger particles settled on the oropharynx. Pharynx are 3 types, no? We have seen in the physiology. Where there it settle on the oropharynx. Particles which are less than 1 micrometer particle do not settle anywhere because they are exhaled out. So today's lecture was till here. In case of any doubt, you can ask in the comment section. Was the entire series of this pharmacology, because it is used for the medical as well as paramedical students, especially for BMS, BHMS students who wish to practice the allopathic medicines, then they can watch this video and gain the knowledge. And if you want any kind of changes, you can mention in the comment box. And if you have any doubt in any subject, you can ask to your assigned Medicò in the comment box. Okay, thank you, have a good day.